my hope is to kind of talk a little bit about, we've seen through all the presentations today, all the different things that are difficult for these kids to do and all the different things that, get in the way when you're trying to deal with the world, with all the, cognitive difficulties. And so, what are some of these stressors? And I think you've already heard more details about all of these different things, but we know that kids with a deletion at least, have some medical issues, some more than others. Some have gone through multiple medical procedures early on in life and, had a lot of stressors related to that, either long hospital stays, multiple in and out, stays because of surgeries and things like that. Some of them need to be on medications for some of these medical issues, whether it's correcting abnormalities in their thyroid or calcium levels that are off, or, the other slew of medical problems that can go along with this deletion. We also, heard a little bit about how there are various academic difficulties because of some of the issues with executive function and control, and, some of them get diagnosed with ADHD. What the semantics of that are, whether it is ADHD or not, we know there are difficulties with executive control, focusing attention where you want to be, kind of the more conscious cognitive control that you guys heard about a little bit earlier. And those things are big stressors, when you heard about what the child is capable of and what's expected of them can sometimes be not matched very well. So, and then some of these things can lead to anxiety because of the mismatch, but there might also be reasons that they are inherently experiencing more anxiety in various forms, whether it's somatic fears about, pain, or because they have gone through very real medical problems and fears about what that means for the future. Whether it's anxiety about separating from the parents, like you saw that it doesn't tend to go down as they age. It can also look like organizing more obsessively, so there are various ways in which this anxiety can present for these kids. And then all of these things, I think both, it's a bidirectional street, but it causes a lot of stress in the ecosystem, which family is a part of, and because they're, helping the child cope with all of these different things that they're dealing with in their lives. And so our hope here is, as we explore more about targeted treatments, why are these things, why is there more anxiety, why is there all these executive function difficulties, so maybe we can have more targeted treatments. But in the meantime, like I think you heard earlier, that we're seeing that there's a group of kids who are coping well with this, and then there's a group of kids who are kind of, we find, are struggling more with, using the resources they have to meet the needs, whether it's academic or social. And, the hope is to kind of really think of this as increasing more kids who can cope with things, and the kids who are coping with things, help them cope with more things. So if they're coping well, at school, helping them cope well with peers. If they're coping well with peers, helping them cope more with social activities outside of kind of the small peer group. So the idea is to always keep on kind of expanding, take where they are and take them the next step up the ladder, and kind of really thinking of it as we want them to get to the top of the ladder, but one step at a time. And then if they are coping with a lot of different areas, then to do it more times, so that it really is more generalized. And in order to do this, I think one of the things is that we often do focus a lot on, do they have anxiety? Do they have OCD? Do they have ADHD? And I think, while these are very, very important questions, a lot of this is kind of illness-focused thinking. And as we know, there's always a balance between health and illness. And one way of looking at reducing illness is increasing health. And so, looking at what is, like Ingrid said earlier, some of the things that cause resilience or can increase resilience. So can we increase health? And what I'm going to, being a child adolescent psychiatrist, I'm really more interested in mental health, because all of these things, I think, have a big impact on how we, kind of just our emotions and our mental health. And to really think of, working with mental health care providers, not as only when there's something wrong, they have a diagnosed anxiety disorder, they have a diagnosed ADHD, and that's when you go to seek help. The idea is to really think of this as an ally in your kind of team of caretakers who can help you answer some of the questions about how do I increase resilience? What kinds of things, so you heard about some of the things that can help resilience, modeling verbally how anxiety feels for you and how you cope with that. But sometimes it's hard to know where, what's okay, what's not okay. Are you going to confuse the kid if you're constantly telling them? These are all questions that might be hard for you to figure out on your own. One thing I hear a lot when I meet with parents is kind of saying, well, there should be consequences, but we don't want them to get away with everything because they're coping with these problems. But at the same time, we don't know how to figure out where to draw that line. And I think that's a very important question. And I think, working with a team, with a mental health provider who's an expert in mental health, and you're the expert on your child, so that you could really kind of form a team to understand the mental health in your child better, to kind of help increase some of these things, I think are really, really important. And to kind of use them as a consultant, not only when, you see illness, but to kind of really increase health. And what they can also help you with is, kind of keep that eye out for, okay, I think this is really going more into they're stressed and they're anxious, into kind of more illness territory where there is a diagnosable illness, so that you have early detection and early treatment. Because we know from, not just kind of the kids with deletion, but across the board, that early detection and early treatment can help things from either progressing or at least helping them function better with the illness that they have. And this is something else that parents are, often asking me, being a psychiatrist, anything when they have concerns about, well, this sounds kind of a little bit odd. Does this mean this is psychosis? Because this is one thing that parents really worry about a lot. And what I hear often is, parents, because there is such a dearth of specialists who know everything there is to know about the deletion, that the parents are trying to kind of become the endocrinologist, trying to become the primary care doctor, trying to become the psychiatrist or psychologist in order to kind of do all these things. And that can be really hard in addition to being a parent. And so the idea is that you have somebody who can keep an eye out and tell you, well, this, I think is okay, but here's where we start to need to worry, and can help you kind of, do that. And so really to think about mental health is more a primary care model, where you go in to see your primary care doctor on an ongoing basis so that he can or she can make sure that you don't have a problem. You don't just go in, kind of the emergency care model, where you only go into the emergency room where things are kind of so bad that you need care right now. And sometimes that's the only thing that's available, but I think I would really encourage people to think of this as more of a primary care model. And who I'm just going to very briefly go over, so who are these people who can help you in this capacity, and what kinds of things they could help you with. And there's a combination of what's available and what's feasible depending on where you live. But typically, a lot of things, whether it's anxiety or planning an organization, Ingrid talked a little bit about kind of this CBT or cognitive behavioral therapy, but there are therapies that can be provided by licensed clinical social workers or marriage and family therapists, psychologists, psychiatrists, whoever's available in your area. These are all people who are licensed to work in, as finding somebody who knows how to work with kids in that capacity, I think would be helpful. Sometimes you might need medication management if there's, to help them with their ADHD-like symptoms or help them with their anxiety. So as not to kind of say this is going to solve the problem, the idea with these medications is to think about it as like dialing the volume down on the radio so you can hear what's going on in therapy, and you can hear what's being taught to you at school, and you can hear what your peers are saying so that you can engage with them in a meaningful way. Because I don't think, medications kind of fix everything, but they can really be an important part of the recipe for a particular kid. And, again, medication management, a lot of pediatric specialists out there feel comfortable and are knowledgeable about treating kids with psychiatric medications. If that's the case, that's great. But sometimes, especially with some of the more nuanced or complicated issues, psychiatrists, preferably child adolescent psychiatrists, because they're trained, and I'm biased because I had one, but they're trained specifically in working with kids. And something else that comes up a lot, parents ask, and I think I completely understand the frustration, is where they're educating their treaters about the disorder, and they find that either they have never heard about it before or only heard in passing, and that the parents really are doing some of the educating. And as much as I get that there's, this is a very frustrating problem, I also would encourage you to think about the good thing is that anxiety looks kind of very similar as it would look in kids without the deletion, as it looks, there might be nuances. I'm not saying it's the exact same thing, but it can be treated in similar ways because we do know a lot about anxiety. And most people who are helping in treating anxiety might not know about anxiety in 22q deletion syndrome kids, but they know a lot about anxiety in kids and how to treat that. And so kind of finding a treater who, even if they don't know a lot about the deletion, knows a lot about the particular problem you're dealing with in kids and who's open and willing to learn about 22q, I think that's really a good place to start. And what kinds of things can you do to help and maximize well-being, kind of which is where I started, is to teach some of these coping techniques in therapy, whether it's cognitive behavioral therapy or sometimes it's just plain simple kind of behavioral strategies depending on what the kid is able to do. Problem-solving skills, so more didactically, if you're in this kind of a situation or with peers, kind of teaching them more didactic social skills or how to problem solve when there's a disagreement, things like that. Social skills to help these kids increase, kind of deal with more things and screen for possible illness. And then, the psychiatrist or the therapist, the mental health provider will work with the rest of the team on a much broader level. So those were kind of my thoughts.